with another Ask a Director, and today I've got another new face. Welcome, Paul.
Hello.
How are you doing?
Yeah, I'm good, thank you.
Well, Paul, because it's your first time on Ask a Director, I feel very lucky. I had two new directors on last week and this week. Do you want to introduce yourself, tell everyone who you are and what your job role is, please?
So I'm Paul Sheldon. I'm the Director of Finance here at the Trust, and whilst Richard Wheeler is on secondment to cover across both LPT as well as NHFT, I'm sort of the backfill. I'm sort of taking over quite a lot of Richard's role. So, of course, everything to do with the finance side, capital side, although there are some things that have remained with Richard. So estates, for instance,
right,
is still with Richard. So that's kind of my role. I don't think it's too different to what Richard's been doing over the last few years, but and obviously I'm really happy to be here. I've worked in the NHS for 20 years, but this is the first time that I've kind of worked for a mainstream provider.
Oh, how exciting! So
Right.
obviously you're very good at maths.
Not really.
No. I feel like you should have said yes.
Accountants are notoriously bad at maths.
My dad's an accountant. He's like, I'm terrible at maths, Holly,
Yeah.
honestly.
It's quite common, yeah.
Well, we're very glad to have you here. Have you got any plans for your role?
No, I think for the most part, what I've been finding is that at the Trust, because of obviously we've got the outstanding CQC rating, which is wonderful. There's a really strong track record on the finances as well. The foundation trust status gives us sort of flexibility that not every trust has. And again, I think that means that we can have slightly different conversations to other trusts internally as well as in the system. So I think there's a hugely strong track record. I'm finding that everybody's really focused on not only delivering the best care that they can, but also the well-being of their colleagues as well. So I think there's not a lot in terms of revolution really, Holly, for me to kind of focus on. I think there are some subtle changes that the Trust will evolve through anyway, and obviously I'll play my part in that through the next 12 months. But, you know, notoriously finance directors are the ones that say no to everything. So I suppose I ought to play up to that a little bit.
I'm sure every finance director in the whole world is like, don't say that, don't say that.
I genuinely do.
Well, it's very good to have you here. And where is your accent from? Because people will ask me.
Yeah, so I'm not local to Northamptonshire, so my round trip to Berrywood is around 120 miles. So
nice and close.
I'm from the other side of Birmingham, so I'm right on the border of Black Country and Birmingham. So sometimes my accent, my in-laws are from the Black Country, and my parents' family are from Birmingham, so I'm right sort of there in that hybrid. So you might get a bit of a Brummy twang from there time to time.
So importantly then, I guess, what is your favourite football team if you support football?
Well, my family on both my parents' side is they're very local to where Aston Villa was created, born and lives. So my allegiances have never been in question since I was knee high to a grasshopper. So yeah, I have to suffer what the Villa serve to me.
Lucky you. And on that note, we will dive into the questions that we've had from Team NHFT. And the first one is from a Team NHFT therapy service colleague who has recently been on a ward in one of the acutes to treat a patient. They were wearing PPE, so personal protective equipment, the whole time, and they carried out hand washing before and after they entered the ward, as well as using the alcohol gel on their hands upon entering and leaving the patient's room. Since that contact with the patient, the ward nurses have let them know that the patient's swab has come back as positive for COVID. The nurses on that ward aren't isolating as they were wearing PPE. So does this member of Team NHFT need to isolate?
Yeah, so I think given the fact that it sounds from the question that all the PPE guidelines were followed, and certainly sort of gelling the hands as they're kind of going in and out of the patient's room, I think is some evidence of that. So if they followed all of the infection control and prevention guidelines, then there's no need for them to self-isolate. So if they've been wearing their face masks, if they've been using the proper hand hygiene approaches, then no, there's no need for them to self-isolate.
Perfect. Okay, so the next question that we have is probably more for me than you, but I'm going to ask you anyway. So on Monday, comms changed the desktop backgrounds, and it caused some issues with people not being able to see their icons. So what can we do about that?
So for those people that kind of are in that circumstance, and as you can see, I haven't invoked mine today, but for those people that are, if getting, I suppose it's getting in contact with the comms team, Holly, in terms of where you are in terms of resolving that, because obviously people are losing things. We want to make sure that you've got everything that you need to be able to the access to those icons, so we'll be able to put them back. I'm sure you'll be able to do that for people.
Yeah, so we want to, I think this is probably a really good moment for me to say, we listened to your feedback, we absolutely acknowledge it, and we're really thankful for the people that did feedback, because what we've done is we've gone away and we've changed the way the desktop background looks, so the blue should now be darker, so you should hopefully be able to see your icons better. And for things like that, where it's feedback about things like accessibility, the way something looks, if you just drop us an email, both good and bad, it helps us to structure what our comms looks like. So yeah, thank you for all your feedback, and we're sorry you couldn't see your icons. The next question and the last question for you is about the big conversation meetings. I know you're taking part in and leading on some of them, aren't you? So this person can't attend any of the big conversation meetings, but still wants to take part. So what should they or can they do to have their voice heard?
So I think for the most part, there's been every effort has been made to make sure that we can get into as many people's diaries as possible. And so, yeah, certainly the one I'm leading is on a Saturday evening in a couple of weeks. So but obviously that doesn't fit with everyone's diaries and work plans. So what I would encourage everyone is certainly don't worry about not being able to contribute. So there's been a Slido space which people can contribute to. It's all anonymous, that feedback. So that really then does feed into the overall conversation, Holly, about the future of the trust and about where we can where we go next. And I think as far as the access to Slido is concerned, I think you can do it from your phone. You can get the Slido web page up, and I think that, I mean, certainly like something I've used in the past. It's quite amusing and quite good fun to be able to do it, but it at least means that people's thoughts and maybe their worries can be able to be captured alongside everybody else's that are participating in those meetings.
Definitely. And I mean, the QR code, I know some people are probably not, they might be thinking, what's the QR code? So the QR code is it looks like a barcode, a square barcode, and it's sat on the desktop background, which is changing, but we'll still have the barcode on it. And if you have a smartphone, so one of the work phones, for example, you just need to open your camera and hold it up to that QR code, and a little message should come and say, do you want to open this? And you say, yes, please. And then it will open. And I also got told just before we came onto this call that there will also be writable posters. So posters will be going up on some of our sites, and you'll be able to write on them. So staff who can't access it technologically, that word, will be able to, whatever that word is, we'll be able to do it with some handwritten notes on a poster. But thank you so much. That was super helpful, Paul, and it was really, really nice to meet you.
Yeah, you too.
Was it really scary? Will you come back? I ask this every time someone new comes on. Will you come back?
Of course I'll come back.
I've not scared anyone off so far, which I think for me is quite good. So thank you so much. I always ask directors at the end of these videos if you've got anything you want to say to Team NHFT, just a message you'd like to put out there. Do you have anything?
It's just really, I mean, obviously, I'm still sort of, I'm 6 or 7 weeks into my NHFT adventure, and I think everybody that I've met, I've been greeted warmly and genuinely. It's really obvious that kind of this is an organisation that sort of cares for its people, its staff, and its patients, and genuinely that comes across in all the conversations I've had so far. So I just want to kind of make that point. Really, it's not always that obvious. So I just wanted to thank everyone for their warm welcome.
Thank you. I think it's really interesting when people come from outside of our organisation and see that, because I guess when you work within it, you stop seeing that element, don't you? So to have, someone like yourself come in and say, actually, people feel genuine and they're passionate about what they do. I think it's really poignant. So well done, Team NHFD. Very proud.
Absolutely.
Thank you so much for coming on. We will be back next week. Well, we won't be back. We'll be back in a few months, you and me, but yeah. I'll be back next week with, I'm going to say June night. So keep your questions coming in. And thanks, everyone. Bye.